CNA Final Exam/Practice Test 2023. Which of the following is a task that nursing assistants commonly do? A. Giving medication. B. Bathing residents. C. Changing sterile dressings. D. Giving tube feedings. The correct answer is B. Bathing residents. Dementia is A. Terminal illness. B. Loss of mental abilities. C. The number of days a person stays in a healthcare facility. D. Caring for the whole person. The correct answer is B. Loss of mental abilities. Which of the following is an example of nonverbal communication? A. Writing a note in a resident's chart. B. Giving an oral report to a supervisor. C. Smiling at a new resident. D. Speaking in an encouraging tone of voice to a resident who is moving slowly. The correct answer is C. Smiling at a new resident. Which of the following types of healthcare is generally for people who will die in 6 months or less? A. Long-term care. B. Outpatient care. C. Intergenerational care. D. Hospice care. The correct answer is D. Hospice care. How many hours of training does OBRA require for nursing assistants? A. At least 150 hours. B. At least 100 hours. C. At least 75 hours. D. At least 50 hours. The correct answer is C. At least 75 hours. Which of the following statements is true of a nursing assistant's role in restorative care? A. If a resident takes too long to do a task by himself, the nursing assistant should do it for him. B. The nursing assistant should give the resident pain medication just before the rehabilitation session begins. C. The nursing assistant should recognize that setbacks occur and be reassuring. D. The nursing assistant should tell the family progress is happening faster than it really is so they can feel better about the situation. The correct answer is C. The nursing assistant should recognize that setbacks occur and be reassuring. One reason that the Health Insurance Portability and Accountability Act, HIPAA, was created is to A. Make sure nursing assistants receive adequate pay. B. Protect privacy of health information. C. Ensure that care procedures are performed properly. D. Prevent abuse of residents. The correct answer is B. Protect privacy of health information. Which of the following is an example of professional and ethical behavior by a nursing assistant? A. Keeping quiet if he makes a mistake. B. Documenting care accurately and promptly. C. Telling his friend details about the residents he works with. D. Rushing a resident through tasks if there is not much time left in the nursing assistant's shift. The correct answer is B. Documenting care accurately and promptly. O. Maintain good body mechanics while lifting or carrying an object. A nursing assistant should A. Hold the object out and away from her body. B. Face the object or person she is moving. C. Twist at the waist as she picks up the object. D. Try to keep her center of gravity as high as possible. The correct answer is B. Face the object or person she is moving. When is it appropriate to use medical terminology? A. When communicating with the care team. B. When communicating with residents. C. When communicating with residents' families. D. When communicating with visitors. The correct answer is A. When communicating with the care team. What information does a Material Safety Data Sheet, MSDS, contain? A. Costs of the chemical. B. Comparisons with other chemicals. C. Names of other facilities using the chemical. D. Description of emergency response actions. The correct answer is D. Description of emergency response actions. Which of the following statements contains objective information? A. Mr. Castillo seems a little grouchy today. B. Mr. Castillo says that he has a stomachache. C. Mr. Castillo's blood pressure is 115/68. D. Mr. Castillo doesn't get along with the nurses very well. The correct answer is C. Mr. Castillo's blood pressure is 115/68. A resident's health information may be shared with A. Anyone who asks. B. Anyone who lives or works at the facility. C. The resident's friends and family. D. Other care team members. The correct answer is D. Other care team members. If a resident is hearing impaired, a nursing assistant should A. Approach the resident from behind. B. Make sure the light is on the nursing assistant's face. C. Raise the pitch of her voice. D. Chew gum while speaking to the resident. The correct answer is B. Make sure the light is on the nursing assistant's face. Holistic care focuses on A. The whole person, including physical, mental, and social well-being. B. Disease and disability. C. How sick a person is. D. The absence of disease and illness. The correct answer is A. The whole person, including physical, mental, and social well-being. The federal government requires hours of continuing education for nursing assistants each year. A. 10. B. 12. C. 15. D. 18. The correct answer is B. 12. Which of the following is a physical need? A. The need to be accepted. B. The need for self-esteem. C. The need to be free from pain. D. The need for independence. The correct answer is C. The need to be free from pain. If a nursing assistant encounters a resident in a sexual situation, she should A. Call the resident's clergy person to discuss it. B. Provide privacy and leave the room. C. Tell other residents and staff members about it. D. Ask the resident to stop what she is doing. The correct answer is B. Provide privacy and leave the room. Which of the following is true of most elderly people? A. They are active and have many interests. B. They do not manage money well. C. They are usually grouchy. D. They do not like to leave home. The correct answer is A. They are active and have many interests. Making an area or object completely free of all microorganisms is called A. Infection prevention. B. Disinfection. C. Transmission. D. Surgical asepsis. The correct answer is D. Surgical asepsis. One way for a nursing assistant to communicate effectively with a visually impaired resident is to A. Wait until the resident speaks to her before identifying herself. B. Move the furniture in the resident's room to make it easier for him to get around. C. Avoid talking to the resident during care. D. Use the face of an imaginary clock to explain the position of objects. The correct answer is D. Use the face of an imaginary clock to explain the position of objects. Restraints may be used. A. Whenever it is convenient for the facility staff. B. When a resident is being uncooperative. C. When there are not enough staff members to watch all the residents. D. Only with a doctor's order. The correct answer is D. Only with a doctor's order. Infection prevention is A. The way in which infections occur. B. An infection limited to a specific part of the body. C. A set of methods used to prevent the spread of disease. D. An object that has not been contaminated with pathogens. The correct answer is C. A set of methods used to prevent the spread of disease. In military time, 7:45 p.m. would be A. 0745 hours. B. 1975 hours. C. 1945 hours. D. 0775 hours. The correct answer is C. 1945 hours. How is HIV spread? A. Through the air. B. By hugging an infected person. C. By standing next to an infected person. D. By blood. The correct answer is D. By blood. In which of the following procedures must a nursing assistant always wear gloves? A. Shaving a resident. B. Combing or brushing hair. C. Dressing a resident. D. Turning a resident. The correct answer is A. Shaving a resident. Most of the accidents in a facility are related to A. Falls. B. Burns. C. Poisoning. D. Choking. The correct answer is A. Falls. When beginning to weigh a resident, the scale should be balanced at A. 0. B. 5 pounds. C. 10 pounds. D. -2 pounds. The correct answer is A. 0. One way to prevent burns and scalds is to A. Check water temperature before giving a bath or shower. B. Serve residents drinks while they are standing. C. Leave warm water applications on for more than 30 minutes at a time. D. Use higher settings on hair dryers so residents' hair is not wet for too long. The correct answer is A. Check water temperature before giving a bath or shower. If a nursing assistant is in an emergency situation but has not been trained to perform CPR, she should A. Perform CPR anyway. B. Ask someone at the scene to tell her how to do it. C. Give basic first aid until the emergency medical team arrives. D. Do nothing. The correct answer is C. Give basic first aid until the emergency medical team arrives. A good way to help new residents adjust to life in the facility is A. Think about how it would feel to have to move into a facility. B. Tell the resident how much work it is to care for him. C. Cover up any mistakes to make the resident feel more confident about the facility's care. D. Push residents to join in activities even if they say they don't want to. The correct answer is A. Think about how it would feel to have to move into a facility. Which of the following is true of transmission-based precautions? A. You do not need to practice standard precautions if you practice transmission-based precautions. B. They are exactly the same as standard precautions. C. They are practiced in addition to standard precautions. D. They will not be listed in the care plan so as not to alarm anyone. The correct answer is C. They are practiced in addition to standard precautions. Which of the following behaviors promotes residents' rights? A. Deciding which clothing a resident should wear if she takes too long to decide for herself. B. Letting residents know when they are eating too slowly. C. Providing privacy during all care procedures. D. Restricting visitors for uncooperative residents. The correct answer is C. Providing privacy during all care procedures. Dangling means A. Sitting up with feet over side of bed. B. Sitting up in chair with feet on floor. C. Lying in bed with feet over side of bed. D. Hanging both arms over chair rests. The correct answer is A. Sitting up with feet over side of bed. Which of the following is true of bladder retraining? A. The NA should encourage the resident to drink plenty of fluids even if incontinence is a problem. B. The NA does not need to keep a record of the resident's bladder habits. C. The NA does not need to wear gloves when handling body wastes. D. The NA should let the resident know when he or she is taking too long to urinate. The correct answer is A. The NA should encourage the resident to drink plenty of fluids even if incontinence is a problem. In which position is a resident if he is lying flat on his back with his head and shoulders supported by a pillow? A. Lateral position. B. Sims position. C. Supine position. D. Prone position. The correct answer is C. Supine position. When handling dirty linen, a nursing assistant should A. Carry it close to her uniform. B. Wear gloves. C. Fold or roll it so the dirty area is on the outside. D. Shake it to remove any particles before disposing of it. The correct answer is B. Wear gloves. When transferring a resident who has a weak side. A. The weak side moves first. B. The strong side moves first. C. The strong side and weak side move at the same time. D. It does not matter which side moves first. The correct answer is B. The strong side moves first. A general rule for bathing a person is A. Wash from dirtiest to cleanest. B. Wash from cleanest to dirtiest. C. Wash body parts in whatever order the resident prefers. D. Wash body parts in whatever order the nursing assistant prefers. The correct answer is B. Wash from cleanest to dirtiest. When assisting a resident who has one weak side with dressing. A. Clothing should be put on the weak side first. B. Clothing should be put on the strong side first. C. The weak side should be referred to as the bad side. D. It does not matter which side clothing is put on first. The correct answer is A. Clothing should be put on the weak side first. Which of the following terms describes a bed that is completely made with the bedspread and blankets in place? A. Closed bed. B. Open bed. C. Occupied bed. D. Unoccupied bed. The correct answer is A. Closed bed. Under standard precautions, the term body fluids includes A. Sweat. B. Water. C. Juice. D. Urine. The correct answer is D. Urine. A nursing assistant should give nail care. A. Whenever she has time. B. When she is bathing a resident. C. When she notices a resident's nails are getting long. D. When the resident's nail polish wears off. The correct answer is B. When she is bathing a resident. Resident. Which method of taking temperature is considered to be the most accurate? A. Oral. B. Rectal. C. Tympanic. D. Axillary. The correct answer is B. Rectal. The normal pulse rate for adults is A. 25 to 50 bpm. B. 60 to 100 bpm. C. 100 to 150 bpm. D. 150 to 175 bpm. The correct answer is B. 60 to 100 bpm. If a nursing assistant sees a resident being sexually abused, she should A. Remove the resident from the situation immediately and report it to the nurse. B. Pretend not to see it to avoid embarrassing the resident. C. Tell the resident's family. D. Confront the abuser herself. The correct answer is A. Remove the resident from the situation immediately and report it to the nurse. Difficulty breathing is called A. Eupnea. B. Apnea. C. Tachypnea. D. Dyspnea. The correct answer is D. Dyspnea. Draw sheets are used. A. To keep the bed covers from pushing down on residents' feet. B. To keep the fingers from curling tightly. C. To keep a resident's joints in the correct position. D. To prevent skin damage caused by shearing. The correct answer is D. To prevent skin damage caused by shearing. The normal respiration rate for adults is A. 18 to 30 breaths per minute. B. 15 to 25 breaths per minute. C. 12 to 20 breaths per minute. D. 8 to 10 breaths per minute. The correct answer is C. 12 to 20 breaths per minute. The most essential nutrient for life is A. Protein. B. Fat. C. Carbohydrates. D. Water. The correct answer is D. Water. What does the abbreviation NPO stand for? A. Nothing pureed only. B. Not prepared on site. C. Nothing by mouth. D. Nothing by order. The correct answer is C. Nothing by mouth. The artificial opening in the abdomen for an ostomy is called A. Stoma. B. Stool. C. Bag. D. Anus. The correct answer is A. Stoma. To convert ounces to milliliters, multiply by A. 30. B. 20. C. 60. D. 15. The correct answer is A. 30. When providing perineal care for a female resident, the nursing assistant should A. Wipe from front to back. B. Wipe from back to front. C. Wipe the anal area first. D. Use the same area of the washcloth for each stroke. The correct answer is A. Wipe from front to back. According to the USDA's MyPlate icon, which food groups should make up at least half off a person's plate? A. Grains and proteins. B. Vegetables and fruits. C. Dairy and proteins. D. Grains and fruits. The correct answer is B. Vegetables and fruits. The first sign of skin breakdown is A. Muscle damage. B. Blackened skin with pressure ulcers. C. Shallow crater. D. Pale, white, reddened, or purple skin. The correct answer is D. Pale, white, reddened, or purple skin. At which angle should residents be positioned for eating? A. 180 degrees. B. 120 degrees. C. 100 degrees. D. 90 degrees. The correct answer is D. 90 degrees. Which of the following blood pressure readings falls within the normal range? A. 119 of 75. B. 135/90. C. 91/70. D. 140 of 80. The correct answer is A. 119/75. A. Is used for residents who cannot assist with raising their hips onto a bedpan. A. Fracture pan. B. Urinal. C. Portable commode. D. Bedpan. The correct answer is A. Fracture pan. A. N. Stocking is a special stocking that can help with circulation. A. Shear. B. Clotting. C. Rotating. D. Anti-embolic. The correct answer is D. Anti-embolic. A. Urine specimen can be collected any time the resident voids. A. Routine. B. Clean catch. C. 24-hour. D. Sterile. The correct answer is A. Routine. The most common site to take the pulse is the A. Radial pulse. B. Brachial pulse. C. Carotid pulse. D. Pedal pulse. The correct answer is A. Radial pulse. How many feet does a quad cane have? A. 1. B. 2. C. 3. D. 4. The correct answer is D of 4. The process of breathing in and out is called A. Inspiration, B. Respiration, C. Expiration, D. Expansion. The correct answer is B. Respiration. Residents with COPD have trouble with A. Breathing, B. Urination, C. Losing weight, D. Vision. The correct answer is A. Breathing. When a resident uses a cane, walker, or crutches, the nursing assistant should A. Stay on the resident's stronger side, B. Stay on the resident's weaker side, C. Walk in front of the resident, D. Walk behind the resident. The correct answer is B. Stay on the resident's weaker side. Signs and symptoms of clinical depression include A. Intense hunger, B. Breath that smells fruity, C. Intense, sudden chest pain, D. Apathy. The correct answer is D. Apathy. The best time to collect a sputum specimen is A. Early in the morning, B. After the resident has eaten a meal, C. Right before bedtime, D. Right before lunch. The correct answer is A. Early in the morning. Weakening, wasting away, and decrease in size of a muscle is called A. Dystrophy, B. Atrophy, C. Contracture, D. Dislocation. The correct answer is B. Atrophy. Which is the last sense to leave a person? A. Sight, B. Hearing, C. Touch, D. Smell. B. Hearing. After a total hip replacement, the hip cannot be bent or flexed more than degrees. A. 45, B. 75, C. 90, D. 100. The correct answer is C. 90. Which of the following is a care guideline for residents recovering from a CDA? A. Do as much as possible for the resident so that care can be completed more efficiently. B. Encourage resident to finish tasks as quickly as possible to help speed recovery. C. Assist with ambulation to prevent falls. D. Place food in the affected/weaker side of the mouth when feeding. The correct answer is C. Assist with ambulation to prevent falls. A tumor that is cancerous is called a N tumor. A. Opportunistic, B. Benign, C. Malignant, D. Metastasized. The correct answer is C. Malignant. Which of the following statements is true of Alzheimer's disease, AD? A. Skills a person has used over a lifetime are usually kept longer. B. Residents with AD will show the same signs at the same times. C. NAs should do everything for residents with AD. D. Alzheimer's disease is a normal part of aging. The correct answer is A. Skills a person has used over a lifetime are usually kept longer. Which of the following is a guideline for safe diabetic foot care? A. Inspect and clean residents' feet every day. B. Clip residents' toenails frequently. C. Use lotion between the toes to prevent dryness and cracking. D. Use hot water for bathing the feet to help prevent infection. The correct answer is A. Inspect and clean residents' feet every day. If a resident with Alzheimer's disease has problems with bathing, the nursing assistant should A. Schedule bathing when the resident is least agitated. B. Hurry the resident through the bath. C. Insist that the resident bathe even if she does not want to. D. Surprise the resident with the bath. The correct answer is A. Schedule bathing when the resident is least agitated. A diabetic resident should A. Skip meals. B. Go barefoot. C. Receive careful foot care. D. Avoid exercise. The correct answer is C. Receive careful foot care. HIV can be transmitted. A. To a nursing assistant who touches an infected resident's telephone. B. To anyone who uses the same toilet as an infected person. C. To people who hug an infected person when that person has a fever. D. To a fetus by an infected mother. The correct answer is D. To a fetus by an infected mother. Which of the following thermometers is used to take a temperature from the ear? A. Oral thermometer. B. Rectal thermometer. C. Tympanic thermometer. D. Axillary thermometer. The correct answer is C. Tympanic thermometer. Which of the following statements is true of HIV and AIDS? A. AIDS can be cured. B. Having unprotected sex puts a person at a high risk for HIV/AIDS. C. Standard precautions do not need to be practiced on a person with AIDS. D. A person with HIV can be fired because of the disease. The correct answer is B. Having unprotected sex puts a person at a high risk for HIV/AIDS. Alternate communication methods for a resident with an artificial airway include A. Playing charades. B. Shouting at the resident. C. Asking the resident's family what they think he wants. D. Using communication boards. The correct answer is D. Using communication boards. When assisting with ROM exercises, the nursing assistant should begin at the and work her way, the body. A. Abdomen, up. B. Feet, up. C. Head, down. D. Thighs, down. The correct answer is C. Head, down. How should residents be positioned while they eat? A. Lying flat on their backs. B. Reclining at a 45-degree angle. C. Sitting as upright as possible. D. Lying on their sides. The correct answer is C. Sitting as upright as possible. One way for a nursing assistant to help a resident with Alzheimer's disease with eating is to A. Put a few types of food on the plate at the same time. B. Use dishes without a pattern and a simple place setting. C. Withhold food until the resident is really hungry. D. Serve steaming hot foods and drinks. The correct answer is B. Use dishes without a pattern and a simple place setting. Orthotic devices are used to A. Keep joints in correct position and improve function. B. Assist residents with ADLs. C. Maintain proper body alignment. D. Prevent rubbing, irritation, and pressure ulcers. The correct answer is A. Keep joints in correct position and improve function. When should documentation be recorded? A. Immediately after care is given. B. At the end of the shift. C. Whenever there is time. D. Before the care is given. The correct answer is A. Immediately after care is given. An object can be called clean if A. It has not been used on or near a sick resident. B. No dirt or debris is visible on the object. C. It has been contaminated with pathogens. D. It has not been contaminated with pathogens. The correct answer is D. It has not been contaminated with pathogens. In which of the following parts of the body are mucous membranes found? A. Feet. B. Hands. C. Genitals. D. Elbows. The correct answer is C. Genitals. Problems affecting nutritional intake among the elderly and chronically ill include A. Fatigue and pain that occur with certain illnesses increase appetite. B. Older people produce more saliva. C. Increase in physical activity and mobility causes an increased appetite. D. Ability to smell and taste food and drink decreases as people age. The correct answer is D. Ability to smell and taste food and drink decreases as people age. The chain of command is A. A legal term meaning a person can be held responsible for harming someone else. B. The person in charge of the department for each shift. C. The line of authority in a facility. D. The department that a nursing assistant goes to if he wants to report a problem. The correct answer is C. The line of authority in a facility. Which of the following is an ombudsman's responsibility? A. Helping with care procedures. B. Assisting with resolving facility budget problems. C. Investigating and resolving complaints. D. Creating special diets for residents. The correct answer is C. Investigating and resolving complaints. A resident has purchased a special gift for her nursing assistant, Sarah. Which of the following would be the best response by Sarah? A. Refuse but thank her for thinking of her. B. Accept because Sarah does not know her facility's policy on gifts. C. Accept and ask the resident not to tell anyone. D. Refuse and tell her that her employer is very unfair about employees accepting gifts from residents. The correct answer is A. Refuse but thank her for thinking of her. Which member of the care team assesses residents, monitors progress, and gives treatments? A. The nurse. B. The nursing assistant. C. The medical social worker. D. The registered dietitian. The correct answer is A. The nurse. Hand hygiene is A. Washing hands with soap and water only. B. Using alcohol-based hand rubs only. C. Wearing gloves when performing care procedures. D. Washing hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. The correct answer is D. Washing hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. A nursing assistant should reposition bedbound residents at least every A. 2 hours. B. 3 hours. C. 10 minutes. D. 20 minutes. The correct answer is A. 2 hours. Which of the following statements is an example of a fact? A. Mrs. Christensen weighs 142 pounds. B. Mrs. Christensen is too thin. C. Mrs. Christensen seems happy when we serve meatloaf. D. Mrs. Christensen is lonely. The correct answer is A. Mrs. Christensen weighs 142 pounds. How should a standard bedpan be positioned? A. The smaller end should be aligned with the resident's buttocks. B. The wider end should be aligned with the resident's buttocks. C. One of the longer sides should be aligned with the resident's buttocks. D. It should be turned on its side. The correct answer is B. The wider end should be aligned with the resident's buttocks. Which of the following statements is true of spiritual needs? A. Residents will believe in God. B. Residents will be Christians. C. Residents will have different spiritual needs and beliefs. D. Residents will not believe in God or a higher power. The correct answer is C. Residents will have different spiritual needs and beliefs. Where should the call light be placed when a nursing assistant leaves a resident's room? A. On the bedside table beside the telephone. B. Next to the television remote. C. Within the resident's reach. D. On a chair next to the resident's bed. The correct answer is C. Within the resident's reach. Blood pressure is measured using A. Thermometer. B. Watch. C. Finger. D. Sphygmomanometer. The correct answer is D. Sphygmomanometer.